Ok, amore mio. Ciao.
Ciao.
So surgery is going well.
Yes, I am 3 weeks post-op today.
Yes?
So I think that I am almost back to normal, even though I'm supposed to take it easy for another week.
Yes. So go really well. But do you wanna tell when came the results? Because we go a little bit panic, right? For a while because you read wrong a little bit the
Okay, so you know how
results.
they give you the results in the portal? If you have an online portal with your provider, they send the results and you can see them before you talk to the provider.
Yes.
But the results are full of a lot of medical terms that are similar to other medical terms. When you Google it, which you're not supposed to Google, I know, but when you Google it, other similar words can pop up and you can think that you have something terrible when in fact you have a regular situation.
Okay, so let's say first the tube. What happened to the tube?
Okay, so the tube, it looks like, was just, so we know it was dilated and full of like blood, but I think what happened was because of adhesions and everything, it was stretched and damaged and pulled. So it was just basically like really messed up. So, but it was benign. There wasn't any growth or any tumors or anything in there. It was just a really badly adhesed tube.
Yeah, yeah. The other one, is fine.
Yeah, the other side. You mean?
Yeah,
Yeah, the left side is good. They said that it was just mildly dilated, but enough to leave it without danger.
yes. So what happened to the other one? Because they're doing a biopsy for your uterus because you was bleeding.
Yes, so for the past 3 years, I think, I will always get like a lot of brown. It's not spotting, it's heavier than spotting, but it's not quite bleeding, but it's like brown liquid or discharge or something during ovulation, and it ranges from like a 3-4 day thing to sometimes it lasts like a week and a half, and then it'll stop right before my next cycle starts. So they wanted to do a biopsy of my endometrium to see if there was anything funky going on in there, and this is where I read the wrong term, which I thought meant that I had some kind of like cancer, or maybe not cancer, like a precancer, but it's not. From what I can tell, it's all normal. It's just they're not really sure why that was happening.
Yeah,
So
that.
unfortunately,
But
we don't have the answer, but it's nothing dangerous.
yeah, we just okay. When you said that, it was kind of a little scary because you think about, oh, I'm bleeding for 3 years,
And then I just
and
was
then
told,
we
oh,
just
it's normal,
this.
whatever.
Yeah, but bleeding for 3 years. Then you read that terminology. You go pre-cancer. You think about it like it's because it's not normal bleeding
Yeah.
a little bit,
Right,
But
which was what I was always concerned with, because it just it started out of the blue.
yeah,
I never had it, and then 1 month, boom, it started,
Yeah.
and then it never stopped. So I was really worried.
and that could be a reason for complications if we need to do transfer. Like with if it was true, was done. It was over. It was game over. Was game over. But after that, let's say now we go to the good news. But this is a
Yes.
good news too. This was the scary understanding news.
Scared ourselves.
Yes, by
basically.
nothing.
So basically, just a little rundown of everything that they did. So they went in, and first they saw that I had some adhesions that were connecting my bowel to the back of my uterus. So they were able to free that up. Then they went over and removed the right fallopian tube, took out the endometriomas that were in that right ovary, and there were a lot of adhesions there connecting all of that to the pelvic wall, the uterus, and fortunately I didn't have any like bladder involvement, so they just were freeing all that up, remove all the adhesions. Then they went to the left side. The ovary and everything was attached to my uterus, the bowel, and the pelvic wall on this side too. So they were freeing all that up. They did say that within the adhesions, there were multiple endometriomas. So I guess like but they didn't have cell walls. So it wasn't like they developed, maybe the adhesions trapped fluid. It was very confusing. I still need to get clarity on that. But they were able to free it all up, put everything back in the right position. So that was successful. And then we actually did find out that my septum and my uterus was about 40 to 50% the length, which they wanted to cut it only if it was over 30%, and it was, so they removed that successfully. And yeah, it all went really well.
Yeah, so everything go really well, and that's it. That you have a little bit the infection, right, in one.
Belly button.
So
this is my first time having the belly button incision, and I don't know why, but it seemed to get infected a little bit and it wasn't healing. We're still working on it, but I'm on an antibiotic and I've been putting honey inside my belly button. My doctor told me to put honey in there to help healing, so I'm doing that. And I think it's getting better, right, Amare?
Yeah, no, yeah, in my opinion, it's good, but we keep doing anyway the medicine till the end at this point.
And then one thing too is I was shocked by how little pain I had this time.
Yeah.
Like, I was so good. The shoulder pain that you get with a laparoscopy, it's like the gas nerve pain.
Yeah.
Very minimal. And I was feeling really good the first few days. I was so happy.
Yeah.
Because the last time I was not feeling good. So this time I was feeling really good, and yeah, I'm just getting my strength back.
Yes. So this was the scary news, the everything news, and now it is another news. The third news is, can we book a flight for Italy? So it's official, we know the date. Actually, we don't know yet the date.
Not exactly.
Not exactly. Because how works this process? This process is much easier. Why? Because we choose the date and then we go backwards. Why, amore?
Well, so basically they're going to control my cycle with a birth control. I'm on a progesterone-only birth control pill in order to try and prevent endometriosis from growing back in these few months.
Yes.
And so I'm going to be taking that, and because I take that, the day I stop it, 5 days later, I will have a period. So they already know, like, perfectly timed, and they don't have to go with my cycle, and it's less variables to try and work around. They can control it this way. So we know when I stop the pill, we will go into a period, and then I will go into an ultrasound to check everything, to check the lining of my uterus, to make sure it's all good for a transfer. Then I'll start taking some medicine, and then we will do
the transfer. The medicine is not like United States. So in United States, you need to take this.
It's the dreaded intramuscular progesterone and oil shot. I will not be doing that.
Yeah, we don't do that because Italy don't do that.
Before we started IVF,
Europe, I think.
Europe, yeah. Before we started IVF, I was researching all about it, and everybody was saying, "Oh, this is the worst. It's the most painful. It's awful. It's awful." And you have to do it for like 3 months.
3 months. There's needles like this.
And
you need to go
in your
muscle in the back, and they say everybody have with big
lumps because it doesn't like dissolve.
Like in pain. That I was thinking, oh my god, we need to do that. But Italy tell us we don't do that.
Yeah, so we are taking progesterone, but it's going to be subcutaneous.
Yeah.
Because they're
normal.
They do subcutaneous. Plus, I think some.
The sex is no pleasure, and it's not pleasure.
Yeah.
But
it's better than
it's
that.
much better than, and then you take a pill too. So it is 2 little things instead to do more injections. That it is better because 3 months I was thinking like that is the hard part, ragazzi.
Yeah. So now it's actually feeling like it's gonna be super easy.
Easy.
Another thing is we did talk to her. We're doing one of the embryos.
Yeah, ufficiale.
Originally, we weren't sure if they were going to do both or one, but she decided on one so that we can kind of monitor and see. Fingers crossed, the first one goes perfectly well. But if it doesn't, then they'll be able to adjust for the second one to give us a better chance for the second one.
Better chance the second one. So another thing we need to say, it is this. A small little bad news. With all, can we explain before to the first part of the video about this tube with like little cancer tumor, I don't know, tumor, all that what is going on could be a fact, maybe the eggs developing in that moment.
You mean when we did the egg retrieval?
When we did the egg retrieval,
yeah.
All that
because
nasty.
There's so much inflammation, it creates sort of like a toxic environment, not only for an embryo if you become pregnant, but with the eggs developing. It's a toxic, inflamed environment. So like Alessio said, it can cause bad development.
Development. And then you're wondering now why you don't do first the surgery and then do that, because every time you do a surgery, stuff can go wrong. The surgery can go wrong. The ovary can collapse or
Tissue.
cut a lot of tissue, because the surgery, when they go inside, they don't know. So we have to try to remove first the eggs how much we can, then do the surgery. If everything go wrong, we can retry. But this is speed. Why? Because if the first embryo don't go well, we're gonna have another embryo. Okay, we have to do it almost immediately. So we go back to United States, maybe rebook for the next month. Then if go wrong, we need to redo everything, but fast, because the endometriosis is there waiting to attack
They
Jessi
said
again.
within 6 months of the surgery. So if I had surgery in January, that would be January, February, March, April, May, June. So basically, if the first one in May doesn't work, we would try again in June, I think, hopefully. And if not, we're like right there to do another egg retrieval.
We cannot do early because we need wait 3 months for the uterus to all inside, but the uterus after surgery recovery, and then try to be in a happy place, because take time for the system to recover. Even if Jessi now it is really good.
I'm sorry, I'm just thinking about it makes me so happy. I'm like in dreamy land right now.
Oh, you're thinking.
I'm thinking so positively.
We need to think positive. Okay, everything go well. I don't know. I worry. I always thinking the worst scenario for to be prepared the worst scenario. But I hope everything go well. But I think, if everything go wrong, I need to do this. I need to do that. So it is a little bit of stress. My part.
I think though, we are planned. If it doesn't go well, we know what the next steps are. So I'm kind of releasing that, and I'm just going full forward into let's do it, let's go.
And then who knows the destiny when we were in the hotel with the 7 angels was 5 and 2. The 5 they disappear, and then was two boys, and then was there. I don't know if it's a sign or it's not a sign or whatever. But just say, wow, if you think about all the process, you start thinking, the sign.
And we keep seeing lions all over.
Lion.
Lions.
We need just one lion, right? When we go for the first time, vodka coffee and everything. Yeah. So yeah, it's more excited news. Finally, we talked with our doctor in Italy. They will try to wait first Jessi results, and then they try to wait Jessi how is she feeling. And now we know everything about the results. They said, okay, it's time to go. And that's it. We have the plan.
Yeah, and one thing too I'm going to be doing after next week is I'm going to be starting some pelvic floor physical therapy, because already with my second surgery, but my first with this doctor, I had a lot of pelvic floor issues, and I did a little bit of therapy before, but now the issues have come back with all the extra endometriosis and adhesions. So she recommended to do more pelvic floor physical therapy and some muscle work and hip work, so that I can get things stronger before the pregnancy. So I'll be doing that for the next few months.
And we need to say, you have a little bit of pain, right?
Yeah, I do. It's not as bad.
It's not as bad before, but you still have the pain.
But I still have pain. And I think, like my surgeon said, it has something to do with my piriformis syndrome, which can pop up because of endometriosis and all the tension and the inflammation that you have from years of pain. And I was researching, and it said that it's impossible for it to all just disappear after surgery. Maybe some people, their pain will disappear depending on where it was coming from. But if it's nerve and muscle related, those have been firing in a certain pattern for so long, they aren't just going to wake up one day after surgery and say, okay. You kind of have to work on it and do some of this therapy to get it to a healed place. Yeah,
so we're working on it for the pain. We hopefully it's better than before, but she still have a couple moments. But yeah. This is the situation, ragazzi.
I'm just so
excited. So next couple months, then you're gonna see in live So we're gonna try to update you immediately with
Yes.
our videos, and so you're gonna be a part of this journey. If you go well and bad, you're gonna know everything.
Whatever happens, we're in it together.
We are together.
You're in it with us.
Yes. So thank you so much for watch this update, and see you to the next update, and
Ciao.
ciao.